Hi everyone, my name is David Troy. I'm from the University of Bristol. So in this session we will be presenting two ongoing reviews focused on improving the mental health of children and young people in educational settings. Patricia and I will discuss a systematic narrative review looking at factors and interventions within educational settings that contribute to promoting positive mental health and preventing poor mental health in pupils aged between 5 and 18. This will be followed by Liam, who will present a similar review looking at what interventions in schools benefit LGBT youth, a population that is at elevated risk of developing mental health problems. Globally, evidence suggests that mental health difficulties are on the increase among children and young people. This is likely exacerbated following the global response to the COVID-19 pandemic. Additionally, having had time away from school, young people may find the educational setting with additional COVID mitigation processes in place to be even more challenging to their mental health. Therefore, it is especially important that we clarify what works in educational settings so that we can intervene early in the prevention of poor mental health. So we focused on the following questions. So we were interested in what factors and interventions within statutory educational settings influence development of poor mental health in children and young people and/or improvement of mental health for children and young people. So after removing duplicates, over 22,000 records were screened at the title and abstract level, with 263 full-text articles making it through. 199 of these were excluded for not meeting our inclusion criteria, leaving us with 64 full-text articles included for analysis. Included articles were divided into three categories: studies that targeted organizational or cultural factors, and studies that altered the physical environment. We've included what type of studies were found, and the numbers you see denote how many studies were in each area. Mentoring programs were the most common type of organizational intervention in the literature, followed by physical activity programs and support systems. The intervention type that we found that focused on changing the culture of a school the most was classroom management techniques. How broad school culture could influence mental health was also looked at in a substantial number of studies, followed by changing school policies. There was a limited number of studies looking at altering the physical environment. There was also a number of multi-component studies that didn't neatly fit into these three categories. As you can see, there was a wide range of mental health outcomes explored, and I'll hand over to Patricia now, who will discuss how this is all connected.
Thank you, David. This model shows the key relationships that we found in the literature. Where there was strong evidence, the relationship is shown with a green arrow. Where there was weaker evidence, the relationship is shown with a dotted line, and the red arrow shows a negative effect on mental health. The mental health outcomes and factors are color-coded as per the previous slide, with externalizing problems in pale red, internalizing in pale green, and positive outcomes in pale blue. Moving on to our key findings, the dark blue squares show the organizational factors, and as we saw in David's slides, mentoring, support systems, and physical activity were the primary ones. Mentoring, whether from peers, older students, college students, or adults, influence a range of positive and negative outcomes, with adult mentoring having a strong effect on self-esteem, while mentoring of secondary students had no effect on any mental health outcomes. And something that's not shown here is that being a mentor had a positive effect on their self-esteem too, even though they're typically from a slightly higher functioning group. In terms of support, which include social and financial support and school transition support seemed to have the strongest evidence, whereby it reduced anxiety. There was also fairly strong evidence that physical activity reduced anxiety and stress and improved positive mental health, especially self-esteem. Classroom organization, in terms of streaming, had some positive impacts, but also negative. For the cultural factors, classroom management was fairly well studied and appeared to have a strong influence on positive mental health, specifically positive and pro-social behavior and emotional regulation. When looking at the physical environment, green and outdoor spaces had the strongest influence, especially on problematic behaviors. It is important to remember that a number of these factors and outcomes are linked. For example, improved behavior may then improve peer relations. Finally, I would like to point out that there were a few studies that explored a number of factors in combination. These are shown with the yellow lines. These studies also reported behavioral improvements and overall improvements in mental well-being.
Hello, my name is Liam Spencer. I'm a research assistant at Newcastle University, and I'm going to be telling you today about this project, which is part of the Public Mental Health Programme and is a realist evidence synthesis of mechanisms by which school-based interventions may widen or reduce inequalities in LGBT adolescents' mental health. So this project is being led by Liz McDermott and Mark Limmer at Lancaster University, which is part of the LILAC collaboration for public health research with Liverpool University, as well as Bristol University and myself and my colleagues at the Population Health Sciences Institute at Newcastle University, which is a part of FUSE, the Centre for Translational Research in Public Health, and also home to the Directorate of the School for Public Health Research. In this presentation, I'm going to describe what this work is focusing on and why, provide some background information, and I'm going to outline our progress to date in terms of the realist review component of this project, and then also outline our plans moving forwards for the realist evaluation and our future fieldwork. So throughout this presentation I shall refer to LGBT, which stands for lesbian, gay, bisexual and transgender, but I appreciate that there are different other iterations of initialisms such as LGBTQIA+. So globally, research indicates that LGBT young people have elevated rates of poor mental health in comparison to their cisgendered heterosexual peers. The school climate is a key risk factor for this, and homophobic, biphobic and transphobic bullying and violence in schools is consistently associated with negative mental health consequences for LGBT adolescents. Additionally, UNESCO have stated that addressing this problem is critical to meeting human rights commitments, including the right to education and the rights of the child. So for the first part of this project, we have been conducting a realist review, which is aimed to develop a theoretical understanding of the education environment and interventions that may widen or reduce LGBT adolescents' mental health inequalities. And in order to address this aim, we have two specific review questions. Firstly, what evidence exists that school-based interventions can prevent or reduce mental health problems in LGBT adolescents? And secondly, how, why, for whom, and in what context may these school-based interventions work? So our review is being conducted utilising a 7-step protocol, which has been published on Prospero, and I'll include a link at the end of the presentation if you wish to have a look at that. The review was designed to include all types of school-based interventions that impacted on LGBT adolescent mental health, including all studies designed, so both qualitative and quantitative. Our search strategy included comprehensive electronic database searches, as well as additional complementary search strategies, including hand searching and citation tracking, which were undertaken as we progressed through the screening process. All of the studies were subjected to an inclusion criteria and subsequent quality appraisal, and those that were included in the review were subjected to data extraction and a realist review synthesis, which I will go on to provide some more information on. We applied our search strategy to the following databases: CINAHL, Embase, ERIC, PsycInfo, PubMed and Scopus, and initially returned 6,597 results, which after removing duplicate results was reduced to 4,911. Two researchers screened at title and abstract, and this left us with 125 results, which we then went on to screen at full text. In the end, we included 15 empirical papers, which were original research reporting on interventions for our realist review, but we also included an additional 54 papers to help us develop our theoretical and conceptual understanding of the mechanisms within those interventions. We went on to extract data from our 15 included papers in order to identify context, mechanism and outcome, or CMO configurations, in order to help us better understand how, why, for whom, and in what context these interventions work. So this is represented visually on the left-hand side of the slide, and the mechanism component in the middle here is split into intervention resources. So, for example, a reduction of bullying in the classroom, and then individual cognitive reasoning. So this might be young people feeling less stressed because bullying has reduced. And then these data were extracted in conversation with the logic model, which is on the right-hand side of the slide. So throughout this first phase of our work on this project, we continue to meet with young peer researchers who identified as LGBT in order to share some of our findings and discuss the features of the interventions that we had identified through our searches. So we're currently at the stage of synthesis and theory development, and I can share with you today some emergent thematic findings which relate to the mechanisms at play within the interventions that we have included in our review. So firstly, for intervention resources, the first theme that we have is the framework of the intervention, and this includes safe supportive environments, available information and resources, and a strong organisational structure. Secondly, activities as a result of the intervention, and this includes advocacy and facilitating engagement in behaviours that reduce the likelihood of future prejudiced events. Next up, philosophy behind the intervention, and this includes being client-centred, non-judgmental, providing harm reduction, addressing minority stressors, and affirmative mental health promotion programming. And lastly, for support, community and representation, we have positive role models, peer support, shared experiences, and support and socialising. Secondly, moving on to individual reasoning, we have for connectedness, community and support, reduced isolation, social support, safety and belonging, acceptance through others, and support and encouragement. For relationship to the wider context, we have a more supportive whole school context and reducing stresses. And then for internal cognition, we have examining own feelings, coping and emotional regulation skills, and developing coping strategies. As we are moving towards the final stages of this review, we are preparing a manuscript for submission to the BMC Public Health Journal, but also this first part of our project is integral to the next stage, our realist evaluation stage, which we're currently in preparation for, and I'll tell you a little bit more about now. For this next phase of our project, we're going to be working in collaboration with Stonewall, the charity which campaigns for equality of lesbian, gay, bi and trans people across Britain, in order to identify 4 secondary school case study sites which have received an anti-homophobic, biphobic and transphobic bullying intervention. So our study is going to develop a theory that explains why and how a school anti-HBT bullying programme may prevent poor mental health amongst LGBT young people. We have 3 specific aims, which are to test the programme theory which we developed in the Realist review, examine the intervention implementation process, and gather stakeholder perspectives on the intervention and how it might promote positive mental health. So our data collection through this phase of the project is going to consist of face-to-face interviews with the potential for online interviews given the current COVID situation, focus groups and observations, as well as a documentary analysis, so for example relevant school policies on bullying and LGBT inclusivity, and then also an analysis of administrative service data, so things such as attendance and exclusion figures. And our LGBT young peer researchers are going to continue to be involved throughout this phase of the project. So if you would like to find out more about our work, of course, as we progress through it, there's going to be further opportunities such as this to disseminate our findings, as well as publications in the future. But for now, if you wish, you can take a look at the protocol on Prospero, which I mentioned previously, or please feel free to email me or find me on Twitter if you have any questions or queries or want to find out anything more about this project. Thank you very much for listening.